Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg, and thank you to our Pedo Teeth Talk sponsor, Hugh Freedy, for helping us bring you great content. We couldn't do this without them. Visit them at www.hughfreedy.com. That's HU-FRIEDY.com. We're here today with Dr. Jessica Webb, pediatric dentist and expert in bioethics, to talk about ethics, morality, and bioethics. Jessica Webb is a pediatric dentist practicing in Children's Village, a interdisciplinary clinic for children with developmental disabilities in Yakima, Washington. She serves as the Associate Program Director for the NYU Langone Advanced Education in Pediatric Dentistry Residency Program. Dr. Webb co-authored the textbook Dental Care for Children with Special Needs. She is a Fellow of the American Academy of Pediatric Dentistry and also a Diplomate of the American Board of Pediatric Dentistry. She was Chair of the APD Committee on Special Needs for 5 years and serves on the Council on Postdoctoral Education. Dr. Webb was the 2020 recipient of the APD's Manny Album Award. Dr. Webb was born and raised in Los Angeles, California. She completed her undergraduate education at San Diego State University and then attended dental school at UCLA. She trained in pediatric dentistry at the University of Washington and Seattle Children's Hospital, at which time she also earned a Master of Science in Dentistry and a Master of Arts in Bioethics and Humanities. Additionally, Dr. Webb completed an MS in Recreational Therapy at Indiana University and is a certified therapeutic recreation specialist. So, Dr. Webb, thank you so much for being with us today.
Thank you for having me.
So to jump right in, tell us, because there's so many possible ways to define it, what is ethics and what is bioethics?
Sure. So I think a lot of these terms are things we throw around, morality and ethics in everyday conversation, and sometimes we don't really have a tangible working definition for them. So morality is sort of the concept that we think of as right and wrong. And what ethics does is ethics takes the tools of philosophy and applies them to morality and helps us figure out what's right and wrong and grapple with some of those challenging situations we find ourselves in life and certainly as clinicians. Ethics really tries to deal with those gray areas where we don't have clear right and wrong. A lot of times, we think about what's legal, and that isn't always what's ethical, or something that may be ethical could potentially not be legal. We also try and steer away from thinking about just popular opinion, and just because everybody does something doesn't necessarily mean it's right. We try and push back on that and kind of think about it a little bit more critically, so we get to sort of the best possible outcome and aspirational goal. And one of the big things with ethics is that reasonable, intelligent, thoughtful, well-intentioned people can disagree. And that's okay. The work of ethics is to have those conversations and navigate those challenging situations to come to sort of the best conclusion and possible outcome. And so learning how to have those conversations where we can disagree. And then bioethics. Before you talk about,
I'm sorry if I could interrupt, before you talk about bioethics, I wanted to ask you on the disagreement part. It's intriguing. Would you suggest that it's important to, before you come to sort of like an ethical assessment or judgment or determination, whatever it may be, based on your definition of ethics, it is important to hear other input with people who disagree, or is that, not important?
Yeah, I think one of the things is, and one of the tools that I found really helpful in ethics is really thinking about every possibility and trying to think of all the possible strategies and outcomes. And is your first step not trying to get to a conclusion, but really trying to think through all of the different possibilities. And I think that's actually one of the tools through training in ethics that has been the most helpful for me. And I think, as pediatric dentists, this isn't a foreign concept to us, right? When we're planning a treatment plan or something like that, we can think of all the different choices, especially, as an educator, when I'm working with a resident, it's like, well, what could we do? What are all the different possibilities? And then we winnow it down to sort of the best choice for that child, that situation, that family. And it's the same kind of thing in ethics is what are all the possibilities? And let's think of everything that we can and really try and brainstorm and then get down from what could we do to what should we do and what's the best possible outcome and what is the course we ought to take.
So given that, so bioethics is an extension of ethics in that environment?
So bioethics applies the tools of ethics to the healthcare setting. And sometimes you'll hear it referred to as medical ethics, and the terminology has shifted to bioethics over the years to more broadly incorporate all of healthcare, and also to incorporate biomedical research and research with human participants. Bioethics also wants to concern itself with integrating human values into biomedical science, right? So we're trained as clinicians. We love evidence-based and all of those things that make our practice strong. But in the same way that we don't just treat teeth, we treat children. It's the same concept in bioethics. There's humans attached to that healthcare system and that evidence base of literature and things like that. And so figuring out how to meld the two together, again, for the best possible outcome for those patients.
I wish we all had more information about what you've learned. And I wanted to ask you, how did you, I've known you for a long time, Jessica, and I should know the answer to this, but how did you end up getting into ethics training? Why did you decide, and what was the process in your head at the time?
Well, at the time I was at University of Washington doing my residency and receiving a wonderful clinical education, but I found as I started practicing, I had all these questions and all of these situations with families to navigate that didn't have answers in pedo textbooks, right? And weren't in the reference manual and things like that. And so, especially with my interest being kids with intellectual and developmental disabilities, then there's even more complicated and nuanced moral questions. And so I pursued getting a master's in bioethics. Now, at the time, I think I was a little bit naive in that I thought I'd go get training in bioethics and then I would have all the answers and feel confident in all those things. I had questions, and really it just taught me how to ask more questions and gave me more things to ponder. But it also gave me a skill set and tools to help navigate some of those dilemmas. And I think as we get older and more experienced and work with families more and teach more and all the things in our career, you find that there's more and more gray areas and things are more complicated and nuanced than we thought. It's not as clearly black and white as you hope it to be when you're coming out of dental school. And so it's been a really, really useful skill set for me.
Yeah, and I know you're also very interested and have acted most of your career and personal life in supporting bridging disparities and access to healthcare, et cetera. So would you say that your interest in disparities in research and improving what are disparities related to your interest in bioethics, and how do they connect?
Absolutely. One of the huge foundations of ethics and certainly bioethics is the issue of justice. And the lens through which I have approached that work is through disability and concerns with ableism and those types of concepts, and advocating for equal access to care and equity for the disabled population with regard to oral health disparities. And I think as pediatric dentists, we know as well as anyone the concerns with justice and access and disparities working with oral health, where those disparities are so magnified, and we really see the outcomes of this. And we all know that oral health disparities aren't something that we can prep our way out of. And so that's why I'm so grateful to be part of the profession of pediatric dentistry, and so proud of all the work AAPD does to really go upstream, because we know that there's bigger issues that lead to kids ending up in our chair with early childhood caries. And so the idea of justice is people getting that to which they are entitled and treating like patients alike unless there's a clinically relevant reason not to do so. And it's also navigating the difference between equity and equality. So in the pursuit of justice, sometimes the response is to have some sort of blanket policy to give everyone the same thing. And that's equality. Everyone gets what's equal. But we're going to do better work by thinking about equity and the idea that different people are going to need different things in order to achieve that same goal. So in our case, optimal oral health. But even if you think about something as simple as our recall schedules, right? If the goal is for every kid to be caries free, some kids can come in every 6 months. Some kids need to come in every 3 months, and we adjust what we do in order to best serve that child and the situation they're in and their risk. And so it's a concept that we're familiar with. It's just thinking more about how we do this more systemically to create that equity and ensure, again, in our case of pediatric dentistry, that all kids have optimal oral health.
That's wonderful, and I'm so glad that we're talking today. And you're a role model to me, Jessica, I have to say, and I hope that those who listen to this podcast will refer to it today and down the road, because we are pretty good at this, but we always need guidance and expertise such as yours to take us down the right path and make sure we stay in the right path, because I think we're all well-intended, but we need some education and correction, if you will, to make sure we stay on that path. I want to talk to you about the phrase ethical dilemmas. We talk about ethical dilemmas a lot. What does that mean? And how do you resolve them if there is a dilemma?
Yeah, that's a great question. A lot of times I think, again, it's a term that people use without always understanding all the meaning behind it. And so sometimes I think we'll use the term ethical dilemma when we know the right thing, but we don't really want to do it. And that isn't quite an ethical dilemma. The other time that sometimes it gets thrown around is when things are blatantly wrong. And this is where I think a lot of times ethics in common usage kind of gets misguided, because a lot of times when we hear about ethics, especially in things like media and things like that, it's really somebody did something wrong and they're going before an ethics committee, and it's sort of a punitive thing. And the work of ethics is really sort of that aspirational goal of how can we do better? How can we make everything better for everybody and work towards those aspirational goals? And I remember being in, dental school, and you get training on ethics and you learn principles of autonomy and justice and non-maleficence and beneficence, and it all sounds lovely. And then you get into clinic and you realize you didn't get a lot of guidance on what actually to do with all of that. They're all good concepts. So what do you do? And the idea behind an ethical dilemma, it's when those kinds of principles apply. So I think, we're all living in the midst of a tremendous example of that right now, which is, a conflict between autonomy, people being able to have governance over their own lives, and the concepts of beneficence and non-maleficence of, helping other people and not doing any harm. And we can see how difficult it is to navigate when those principles conflict. And that's sort of an ethical dilemma when you have principles conflicting. And again, it's typically when you don't have any great choices, right? You don't have a perfect solution. If you had a perfect solution, there wouldn't be a dilemma. The problem is you have conflict and not a great decision. And the difference is you have to make a decision. And that's where the work of clinical ethics is. And that's why I really like sort of the tangible aspects of clinical ethics, because you can have these philosophical conversations and, they may be interesting concepts to discuss, but as clinicians, at the end of the day, we have to do something. We have to make choices and we have to navigate these. And clinical ethics sort of gives us some grounding in how to do that.
It seems like when I think of ethical dilemma, and thank you for that clear definition, it feels like it's sort of a personal or individual application of ethics principles to a current situation. You always hear about it in the context of I'm facing an ethical dilemma, or he or she faces or faced an ethical dilemma. Is that a fair way of looking at the term ethical dilemma? It's like taking the principles and applying them to me in this situation.
Yeah, and I think it's more we end up in a situation and the principles are conflicting sort of by the fact of the situation. And then we are responsible for sort of navigating that. Another ethics concept that can come up as healthcare providers is one called moral distress. And that's where we have a sense of what's right and what needs to be done, but there's kind of external constraints on not letting us to do that. And that can be really challenging for providers, and they end up in an internal moral conflict between what they think should be done and what they can actually do given the circumstance.
We will now pause for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing, offering pediatric restorative solutions that keep you performing at your best. For more information on Hugh Freedy products, visit www.hughfreedy.com/AAPD-crowns.
We are back with Dr. Jessica Webb talking about ethics, bioethics, and pediatric dentistry practice. Jessica, when we think about ethical concepts as we face the COVID-19 epidemic, the crisis that we're still in, what are some of the things we should be thinking about in terms of applying ethical concepts? What are some examples? I'd like to have a conversation with you about this.
Sure. One of the things that I think is an important framework that's really helped me navigate this is the idea of crisis standards of care. And I think is dentists, we are familiar with concepts of triage and limited resources and things like that, but they're not necessarily something we've had to deal with so intimately before. So there's sort of three standards of care during crises, and that's conventional, which is our normal standard of care where we have usual space, staff, supplies. We're able to care for our patients in the way that we typically do and know how. The next level is contingency standards of care. And that's where space may be repurposed. People have changes in roles and responsibilities. We may need to defer non-emergent care. And we have to be really mindful of use of supplies, allocating scarce resources. Typically, we're able to provide somewhat functionally equivalent standards of care. And then the third is crisis standards, where we don't have space for patient care and care can be provided in non-clinical areas. Trained staff may not be available, or we may have inadequate staff to do what we need to. We may not have adequate supplies, and the standard of care changes in that situation. And we have to operate from the perspective of what's good for the most number of people versus what's good for individual patients. And I think that is a concept that, again, we think of in more like disasters and triage situations for medicine. And we haven't had to navigate in this way before. But when COVID started and we all had to sort of batten the hatches, we were in crisis standards of care. We couldn't provide our usual standards of care. We didn't have appropriate supplies to keep everybody safe. We had to defer care of our patients. And now, fortunately, we've shifted at least to contingency care. I think we can certainly say that we're not in conventional care yet for the most part, where we may need to be thoughtful about how we're using supplies, because the goal in contingency care, we can have sort of that functionally equivalent standard of care and move back towards that. But in contingency care, we always want to be mindful of not then pushing the needle back to crisis. So that's one of our big roles. And I think, again, one of the great reasons to be, I'm so happy to be part of this profession and to have the AAPD and things like that is because we've been able to sort of rally together as a community and figure out how we do that and navigating this all together and how do we function in these altered standards of care.
So we're kind of doing both crisis management and contingency management at the same time, would you say?
Yeah, I would think so. Yeah, and it would depend where you are, because obviously some communities are depending on the infection rates in their community, are going to be a different state. But I think for a lot of folks who've been able to reopen, but things look different and their offices flow different, and staff may be doing different jobs than they did before. That's definitely those are all definitely hallmarks of contingency care.
Yeah, and we have, so many variables going on at once, so many balls in the air, just take the PPE subject, with the inadequate supplies currently, which will be hopefully corrected in the very near future. We're faced with maybe it is partially an ethical dilemma. Do I start doing these procedures? I have to protect my patients, but more importantly, sometimes I have to protect my team. And, those kind of become these ethical dilemma decisions, do they not?
Absolutely. Allocation of scarce resources is a huge area of work in ethics. And interestingly enough, as I mentioned, I did my ethics training at University of Washington, and serendipitously, which I didn't know at the time when I became interested in this, but Seattle's actually considered and UW are considered the birthplace of bioethics, because back in the 60s, they invented the first dialysis machines. And
oh, right.
So many people needed dialysis and there just weren't enough machines. And so the initial work of bioethics was, how do we allocate this scarce resource when we have more people that need it than we can provide it for? And we've been really lucky in recent history that we've been able to, have equipment without concern and resources. The only thing we really kind of maybe get into where there truly aren't enough is organ donation and things like that, because that's, again, a finite resource. But right. Moving into this, we've definitely moved into how do we allocate scarce resources? How do we provide who gets what? And it's one of the real challenges to navigate. And then also, tying it back into the justice argument, how do we make sure that certain populations aren't left out and neglected, and people that are vulnerable or underserved, that this doesn't further exacerbate that disparity?
Yeah, and we're gonna face this big time, not on the supply side, although it could be when vaccine comes out for COVID, and the patients who refuse vaccines, regardless of our own positions, what do we do? What's the government going to decide? It's going to be a complicated situation, but ethics is going to be right at the center of it.
Yeah, and vaccine refusal office policies aren't something that I think historically we've dealt with a lot in pediatric dentistry. I think most of us take a comprehensive health history and ask about vaccine history. But in pediatrics, there's been more of a conversation about, do you exclude patients from your practice that aren't vaccinated? And for they're seeing many of the same patients that we are, kids that are too young to get vaccines and kids that may have medical complexities that preclude them from being able to get vaccines. And some offices make the choice to not see those patients so as not to expose other patients in their practice to it. But then the flip side of that is, again, that ends up being another barrier to access for care if those patients can't be seen. And again, we've all been getting even more of an education in public health, but if certain offices say they won't see folks who aren't vaccinated, then do those patients end up congregating in other practices that will accept them? And then are you creating a potential hotspot for an outbreak by having a whole bunch of unvaccinated patients in the same practice? So again, it's something that we haven't had to deal with as much in dentistry. If we end up getting a vaccine for COVID-19, which, hopefully is the case, then it may become more of a conversation in our profession and practices.
I look forward to following up with you on that conversation, Jessica. As vaccine emerges, we need to revisit that topic and get us up to date. And I think this is the topic of ethics education for all of us is ongoing, and I'd love to continue that conversation. But I want to today conclude in our final moments with an extremely important, perhaps the most important subject. And you alluded to this earlier, the relationship of ethics to the subject of justice. So first of all, can you tell us about, we're pediatric dentists. We're here to provide health care. I think we've been good about access to care. A big part of our mission, both the Academy and its foundation, are improving access to care. We're by far the largest providers of care for special needs patients. That's your area of expertise. Also for patients who are on Medicaid. We always try to do better. But justice is something we strive for. So tell us, what is justice as it relates to us, and how do the ethics fit into this?
Yeah, so justice is really the concept of patients getting that to which they are entitled and treating like patients alike unless there's a clinically relevant reason not to do so. So insurance type is not a clinically relevant reason, right? So those types of issues, and those are things that we deal with in our practices routinely. And so I think elevating that conversation to more systemic concerns of justice and how we can address them as a profession. One of the hallmarks of being a profession is that society endows you with the privilege and the responsibility of having this sort of monopoly on oral health knowledge, right? And we've seen that when we were closed for a while. There weren't other people that were able to provide dental care when dentists weren't doing it. It's not something that you can, watch a YouTube video and get up to speed on very quickly. Society has endowed us with that privilege and that responsibility. And with that comes the responsibility that we need to make sure that everybody has access to our services in an equitable way. And so that's going to be the work of us individually and our profession. And it's going to be an ongoing process, but one that is important and we need to continue working on.
And I think, would you say that the very important subject matter of social determinants of health, in which we're a part, suggests that when you take the concepts you've told us about with bioethics and justice, the role that we certainly can play and should play is going upstream and being involved in those core educational processes that lead to health literacy. Because, most of, as we know, caries is a behavioral disease. While we were shut down, the goldfish in the shelves of Costco were gone, like toilet paper, and we're going to have a crisis. I call it the goldfish crisis, because of a lack of education, and that's going to affect a lot of people, and certainly the disparities are going to kick in. So this speaks to the important subject regarding justice, regarding ethics of us being a leader in education, of health education, going upstream and improving health literacy. And I just wanted to get your final comments on that as we close our podcast today, please.
Yeah, absolutely. I think we definitely see the outcomes of those social determinants. And as pediatric dentists, I think we know as well as anyone in healthcare that there's a lot more to this than just brushing habits and flossing. We know there's a lot more to kids getting caries, and it's part of a bigger systemic problem. And it is truly the work of our profession to help mitigate that.
Dr. Jessica Webb, thank you so much for sharing with all of us today. You've excited me to explore my own interest and to change my behavior in my practice. So when I go back to practice, it'll be on Monday. I'm going to employ a lot of what I learned today and also see what I can do and to continue to work with the Academy on the work it's doing to improve access to care for everyone. We will follow up. Thank you for being with us today.
Thank you for having me.
And thank you for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. We'll see you here next time.
Do you need additional CE hours but don't have time to travel to courses? Did you attend annual session and want to listen to the audio recordings? Check out AAPD's new Education Passport. The redesigned and improved Education Passport is AAPD's online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org for more information. For 10% off any product, use discount code TEETHTALK in the Education Passport store.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.